Good afternoon, and from Dallas, Texas, at the International Stroke Conference. And as we wind down this year's conference, I just want to say a couple of things. One of them, first of all, to thank our tremendous communications professionals for all that they did to help put together the recaps that are sent out every evening. Hopefully that has helped you get a better understanding of what's going on here at the conference, but also some of the faces of stroke professionals within our Eastern States region who are participating here. The other thing I wanted to mention is you should be very proud of working for an organization like the American Heart Association that it has puts together these types of conferences. It's so important to help people understand the trends and the latest in research, including from the prevention side to the transportation of stroke patients, to the triage within the hospitals, to the treatment, and then to the secondary prevention, and then to the rehab side. There's so many different aspects of those areas that are so important to ensure the best outcomes for stroke patients. The other thing I think is important for people to know is we not only are sharing that information with over 150 sessions during this time, but also it's an opportunity for people who are in attendance to get to know each other, to network, to connect, and hopefully collaborate in future opportunities. That's going to also continue to help in overall stroke outcomes and stroke connections and stroke collaborations and stroke research and things like that. So much of that goes on here in people just enjoying the networking opportunities. The other thing I'll just mention is there was a great tribute to Dr. Ralph Sacco. And it was provided at one point by Nancy Brown and another point by Dr. Mitch Elkind. And Dr. Sacco passed away not too long ago, and he was the first neurologist to become the American Heart Association's national president. He originally worked out of Columbia University, which is where Dr. Elkind also was working, and was a mentor to Dr. Mitch Elkind. He then moved, Dr. Sacco moved down to Miami, but really set a path for so many young neurologists and was so influential overall. So it was a really great tribute to him. A couple of things that I saw while I was here in different sessions that I thought was really interesting. One, around congenital heart defect patients and how do we make sure we are preventing and properly treating those patients who are susceptible to stroke in some ways. And that was an interesting session to me because you realize all that they're going through as congenital heart defect or heart condition patients and their caregivers, what they're going through, but you don't think about the chances of them also suffering a stroke because of the treatments or because of the ailment that they have. So that was an interesting piece. The other couple of items that I thought was interesting. One, we had a physician from New Jersey talk about how they're using artificial intelligence for the recognizing and triage of stroke patients if needed to a larger institution for care. One of the other areas was around what are the items that are keeping people back from properly overcoming a stroke during the rehab process. Some people do better than others, and what are some of those reasons? And then one other piece too that I thought was really important and really interesting was the disparities in overall stroke, and how do we influence and reduce disparities of care and outcomes for stroke patients. And one of the things we talked about, or they talked about, was hypertension rates and controlling those in urban and rural communities and how important that is. And we think about the work we're doing and hopefully the outcomes that will happen because of that work. Overall, very successful. And you should all be very proud of working for an organization that holds this type of conference together. And I just, as I close out here, I wanted to thank you for all you do to make these types of things happen. I'm going to a dinner tonight, an awards dinner for Get With The Guidelines, where there's going to be 600 plus people in attendance, and they're all going to be receiving recognition and awards as health professionals working for hospitals that are awarded for Get With The Guidelines Stroke Initiative. And that just means that they have their patients in compliance to proper treatment of guidelines based on the American Stroke Association, American Heart Association guidance and the usage of our Get With The Guidelines initiative. So looking forward to that tonight. But as I close it out again, just thank you. And feel free to reach out to me if you have any questions about the International Stroke Conference or the work that we do as an American Heart Association. Thank you.